Resume recording. Okay, it is recording. So do you want to start an introduction or shall I start right away?
So I think you can start right away. You
Okay.
can introduce yourself a bit. That will be the
Okay.
best. Thank you.
Hello, everybody. Welcome to the open learning session, and I'm so thankful for all of you that you have come here to listen to me. I'm Tapasya Kulkarni. I'm a traditional birth attendant, natural childbirth consultant, a doula, a free birth supporter, and a writer, and a lot more. But I would like to describe myself as a birthkeeper because I provide services right from preconception, pregnancy, birth, postpartum, breastfeeding. So most of the things which include the well-being in childbearing years of a woman, I like to study and help people with whatever I gain from my studies. So that's about it. But I would like to share a little bit about how I came to midwifery is because of my kids. I had my twins at home, and it was amazing, empowering experience. Although the later part of the birth went into the hospital because I was transferred and lots of things happened there, but the whole thing prepared me to tell women what happens to their bodies in hospitals, how birth is managed there, and what unfolds in an undisturbed physiological birth, which I experienced firsthand because I had seen two sides of births at the same time in the same birth, thanks to my twins. So I always feel this is divine grace of the mother, that she put me in that situation, and I realized, okay, this is what I want to do. And once I attended my first home birth during the pandemic with a traditional dye in Maharashtra, I was just taken aback with the beauty of home birth and how undisturbed birth unfolds. And afterwards, when I started going to hospital as a doula with laboring women, I really did not find the experience very good. And eventually I stopped going to hospitals as a doula, and enrolled myself into midwifery programs in USA, and did my apprenticeship in Argentina, where I got to attend 10 home births in 1 year with two wonderful home birth midwives. And that's how I'm here. I've been attending home births on and off in India for past 2 years. And I will say it's immense satisfaction seeing those babies come on the planet with lots of consciousness of the parents, of how they want to birth their babies. Sadly, in India, the maternity care scene is not very good. We are having one of the highest number of cesarean sections in history in India and in developing world. We are almost reaching the levels where Brazil is. I mean, Brazil is the country where C-section rate is almost more than 90%. And we are pretty soon headed there, which I find really disturbing because C-section on the one side is sold as a part of feminism, that you don't have to suffer through childbearing and bringing the children on the earth. You don't have to suffer. You can just have a quick C-section, and why should you suffer? Men don't have to suffer. But I really think that is feminism gone in a wrong way, because nobody's telling you how empowering birth can be when nobody tinkers with it, and how beautifully and perfectly it can go when it is left undisturbed. So that is something I like to spread awareness about, that natural birth is possible, and natural birth should be the norm for more than 90% of the women. But right now in urban India, the opposite is happening. So the very foundation of the health of our children is being compromised, because when the baby does not fight to come out, does not make those changes in its very own body and comes out through the birth canal, when this process is surpassed, I think lots of things are compromised, including the immunity of children, including their neurological development, including their trust in this world. Because in the environment that babies are right now being born is very violent. As soon as the baby comes out, the cord is cut, the baby is separated from the mother. It is most of the hospitals, it is put on a steel tray, which is inhuman literally, because babies need human contact all the time, especially in the first hour of their birth. And most babies are getting born via cesarean, where the mother is getting drugged. She's not conscious when the baby comes out. And also lots of drugs are crossing the placenta during labor and reaching the baby. So baby also gets a little bit drowsy while coming out. So there are problems in breastfeeding, bonding. So the problems continue. So if you want to research more, I would encourage you to read Primal Health Research of Dr. Michelle O'Don. They have done extensive research on health of babies from 0 to 12 months, depending on the mode of the delivery. So, and they have found very, very, not shocking, but very disturbing facts that cesarean births also contribute to increased vulnerability to lifestyle diseases after 40 years of age, and lots of immunity issues, increased allergies, increased asthma, increased eye problems, everything in our children. So we are kind of compromising a whole generation in last 40 years with increased rates of cesareans. So that is one of the areas of my passion, where I'm not saying everybody should have a normal birth and everybody has to have a normal birth, but I think most of the women are not given the correct information, and although their intuition knows that they can give birth, they are told the contrary. They are told that you cannot give birth, your body is faulty, and that is why you need a surgical birth, and you should be saving your baby rather than thinking about yourself. And that kind of information is disempowering. When women are told that their bodies are faulty and not working properly in birth, it impacts them very deeply psychologically, and women are not able to take better decision for their children, because very base of the things that if I cannot birth my baby, if I need help in that, I'm going to need a lot of help and advice and validation from other people while raising that child. So and then we say, women are not good decision makers. How can they be if the very thing that they can do is stolen from them? That impacts you for life. So any woman cannot forget her birth for life. So that is why it is very important to know about your birth choices, and why you can say yes to natural birth and how you can attempt it, etc. So that is the whole topic of discussion today. I would like you guys type some questions so that can lead me. I already have a line of uh, you know a lineup for the discussion, but I think questions will guide me more. So you can go on typing, we will answer them in the end of the session. And now I will just move on to the crux of the topics. So our poster says I'm going to discuss the wonders of physiological birth. So let's begin with knowing what is a physiological birth. So all of us, when we say the word birth, all the media images start coming to us. A woman is screaming, she's she's wheeled down to the hospital, and there is an emergency, everybody's running, and then the doctor comes and tells, oh, this is something is going wrong and we need to do a C-section. Or the woman, or the scenes in media, that woman, is VBAC possible? Yes. Yeah, good question. And then a woman is lying on the bed, somebody is holding her hair, her legs, and the doctor is looking at her vagina and telling, how much is the dilation, and they are shouting at her to push and don't sleep and this and that. And there is a lot of panic and a lot of, sense of emergency. These kinds of scenes that flood us. We have never seen how beautifully an undisturbed birth unfolds, how beautifully, babies come out. Woman is a portal, she's bringing life on this planet. She's getting transformed in the process. So this process is really, really beautiful, and nature has made it beautiful. Otherwise we wouldn't be here, so many of us. And this rising rate of torturous birth, traumatic births, as if one feels that maybe it is a design to discourage women from having babies. Really, I mean, it is so anti-life. All what is portrayed about birth in the media, or all the fear, that it feels like, it is a way of population control almost, that women, every, 3 women out of 5 are coming out of their births traumatized, and they don't want to have more babies because birth doesn't, look very pleasant to them, and it is so much manipulated, and so much, fear is instilled in the woman that she thinks, oh my god, I cannot repeat this whole process. So coming back, I digress a lot, sorry for that, but coming back, I know how a physiological birth unfolds. If we have seen animals give birth, or there are lots of videos available on internet of animals giving birth. I know, actually, people giving birth, actual birth videos are also available there if you have watched through them. The basic thing, the basic requirement for a mammal to give birth physiologically, physiologically meaning as it happens in nature, as your body is designed to do it, the perfect blueprint that we are sent with in our genes to give birth. So how it unfolds is, mammals require privacy. Mammals require a sense of safety to make babies and to bring out babies. So, this is a popular saying amongst us midwives, that bring out your baby in an environment in which you made that baby. So to orgasm while in a sexual act, we need privacy. If we feel we are being watched, we cannot have an orgasm. Similarly, when mammals feel that they are being watched, they cannot birth their babies. They need privacy. Cats, horses, dogs, deer, and everyone, mammals like to give birth in dark, and mammals require privacy and sense of safety to give birth. But exactly opposite is happening. As soon as the contractions start, women starts feeling some sensations, you run to the hospital, and there your hind brain, which is the primal brain, our serpent brain, which is overlooking the reproductive functions, it sends the signals that I'm not safe here, because the privacy is invaded. Somebody is putting their hands into your vagina, even sometimes without asking you permission, asking you consent, which is called a vaginal check, to check your dilation, to check how much, your cervix is open. I'll use my props so that it is more clear. Yeah, so this is our uterus with the baby inside, and this is the neck of the uterus, which is cervix. And when doctors tell you how much you're dilated, what they are checking is how much this mouth of the uterus is open. Okay, for the people who don't know. So then there are bright lights, there are smells that put us in distress. Any healthy human being goes to the hospital feels depressed with the smells and with the environment. So I obviously feel, hospitals are not right places to give birth because they are for sick people. But anyway, that is a different topic of discussion. But all this is happening, so sense of privacy is getting invaded, so that you need drugs and pharmaceuticals to speed up or augment your labor, because the labor is a process that naturally unfolds. Your body is going to open naturally, the uterus is going to contract and become lesser and lesser in size and push your baby down and gather the thickness of the fundus, which eventually gives you that expelling reflex of fetal ejection reflex, as we call it. So all this process needs a hormone called oxytocin, and oxytocin is a love hormone. So oxytocin is secreted in highest quantities, in copious amounts, in three events. First is orgasm, second when you are giving birth to your baby, and thirdly when you are breastfeeding your baby. So that is when the oxytocin is secreted by a female brain in copious amounts. So this love hormone oxytocin, it needs privacy, it needs support, it needs loving reassurance that everything is going fine. But in our hospitals, that is not happening. So in a physiological birth, generally a woman is free to labor as she wants. She can eat, drink, use various positions. She can just walk, she can climb stairs. If she wants to just lie down, she can lie down. There is no compulsion on her, there is no IVs going into her, there are no artificial oxytocin that is being injected to make her uterus push harder on the baby. So all these interventions, we'll talk about the interventions later, but all this is not done in a physiological birth. Then how labor unfolds, sometimes I talk about physiological birth with doctors and they're like, but we are never taught how to sit at a physiological birth, because without hormones, how can we manage labor, how can we control the process, or how can we don't know how much time it will take. And exactly that is the point. Doctors have a limited time, because any system, in any system, when you go, people are working on schedules. People want their life outside the work as well. And sitting at a birth can be a full-time job. A birth can unfold in 2 hours, or it can take up to 64, 72 hours as well. I have sat at 3 hours, 4 hour, 3 day, 4 day labors. So that I definitely know. But how do I manage them, at home births? I don't have to do anything actually. What I do, or what, generally midwives do, is just reassure that woman that we are with you, whatever, for whatever you need, and encourage her to eat, sleep, and drink. And eat, sleep, drink, eat, sleep, drink, use the washroom. That is the ritual that we are using, so that she just rests, because body naturally wants rests after few contractions. Because labor, if the pain was such that it was excruciating and you cannot bear it and this and that, if that was true, women would never give birth vaginally. They would say, no, 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 this is too much, I cannot do this, I will die in this pain. But no, the way our cocktail of hormones functions is oxytocin is secreted, the uterus contracts, then uterus takes a break, endorphins and melatonin and serotonin are secreted, so that we feel good, we feel rested, and we feel encouraged to take on the new contraction. So all this cocktail of hormones is very delicate. So when a woman is put in a situation where she does not feel safe, her privacy is invaded, sometimes, she's almost naked, people are standing, they are looking at her vagina, and they are, telling scary things like your baby's heart rate is dipping and this, or you don't have enough fluid, or your baby has past meconium, and all these things, when she feels so much fear, her body stops laboring. It cuts down laboring, literally, because this cocktail of hormones is disturbed. So what Dr. Michel Odont, I mean, he's a venerable. I have a lot of reverence for Dr. Michel Odont. You can just Google who Dr. Michel Odont is. He was just a general physician in France. He was transferred into to a village called Pithiviers in France, and the hospital was fine. He was the surgeon. Actually, he was general surgeon, and there was one L&D ward, labor ward, and he used to sit there only for emergency C-sections, and they happened very, very rarely. So almost like he didn't have much to do, so he started going to the labor ward and seeing what was going on. And he found out that there were two midwives who were accompanying women in labor, and they were using a lot of reassurance, different positions, different exercises, a lot of encouragement, and you know, encouraging women to labor longer in their homes before coming to the hospital. All these things he saw, and then he started doing experiments of even reducing whatever interventions was there. So he said, what if we don't do any vaginal checks? What if we don't use any pharmaceutical? Let's see, if there is an emergency, we will take action. But why can't we just observe a woman in labor and see how she gives birth? And that's how it started. So they made this small L&D ward like more like home, where people could eat, drink, and then slowly they introduced water tubs where women can go into the water, immerse their bodies in water, so that they were feeling weightless, and their labor pain was the intensity was taken care of, intensity, the edge was taken out by the water. So through all these experiments, he realized that women give birth better when they are not disturbed. So when we use more and more intervention, the birth goes in downward direction, and that is what we call cascade of interventions. So very first intervention is telling a woman that your pregnancy cannot go beyond 40 weeks. And most of the people who have given birth in a hospital system, they must have heard the doctor saying that, oh, after 40 weeks, baby will get bigger, and baby might pass meconium, and the placenta will mature, as if placenta has an expiry date. It doesn't, by the way. So a lot of fear is induced right at the beginning, and women are told to get admitted. Once they are admitted, they are never explained that what doctors are doing are actually inducing labor with pharmaceuticals. First is prostaglandin that they put in your vagina to dilate your cervix. Then they start pitocin slowly. Sometimes they will break your waters with amnihook, and lots of interventions. So that is the first step. Once you get induced, that is the first intervention. And then when your waters are broken, when the pitocin is introduced, it kind of cascades, because you cannot come back from that. Now you have disturbed the natural process already, so you cannot come back. So either there is a birth or there is a C-section, and 60% inductions end up in cesarean sections, in emergency cesarean sections. So what if we just monitor women after 40 weeks and don't scare them that this will happen and that will happen? Then, birth, generally natural labor starts for most of women between 39 to 40 weeks. Some exceptional women will also go to 42 weeks. The highest I have waited was 43 weeks, 4 days. So you just monitor if the woman is doing well. What is her intuition saying? If anything is wrong with the baby, the first person to know will be the mother. Trust me, you don't need any doctor, any ultrasound, any machine to tell you that if your baby is doing fine or not. because we are just stating that baby for 9 months. Our intuition, the divine gives us tenfold more intuition during pregnancy and birth. And that is the state yogis want to achieve. So a woman who is totally conscious and present in her birth, it equals to 7 years of daily 2 hours meditation. That kind of gates are opening. That kind of consciousness is opening in birth. All our chakras are opening, from the top to bottom, because our body is giving way to life to come on the planet. But all this is sidelined. A woman in a medical system is looked at just as a container who contains the baby, and only work is, take out the baby somehow, as if she doesn't have her own personality, she doesn't have her own aspirations, or she doesn't have her own dreams about how this birth should go. So that is the point again, why we want to understand physiological birth. One of the wonders is when the baby is ready, the baby's lungs are ready to breathe in outside air, they start secreting something called surfactant. Surfactant is a soapy substance that helps the lungs not stick together. And once, baby takes its first breath, the lungs remain inflated. So when that is, secreted by the lungs of the baby, the message goes to the brain pituitary gland of the mother that, okay, now labor can start. Baby can survive in outside air. So, oxytocin starts getting secreted. The outer signs of, labor starting is woman will start experiencing some discharge, which is the mucus plug, which is holding this thing tight so that no infection can go up to the baby. That becomes, liquidy mucousy, and it starts coming out. A woman feels a surge of energy. Sometimes women who are approaching labor, it is so amazing that they start cleaning the house suddenly. This is the nesting instinct which the mammals have. They suddenly want to make everything ready because they feel that, oh, baby is coming, my space needs to be prepared for that. That is what we call nesting instinct. And that when that comes in, and women tell me, my clients tell me, oh, this is happening, I feel like sleeping, but suddenly I want to clean everything. And I tell them, don't clean, just conserve your energy for labor, because it is going to happen soon. Sleep as much as you can, because sleepless nights are going to come as soon as the baby comes, and it's never easy to sleep with a newborn. So all these wonderful things are happening in the and the very body, the joints of our pelvis, every joint of our body is kind of getting relaxed because the hormone relaxing is getting secreted. So pelvis is going to open to give birth to the baby. Amazing thing is this coccyx, when baby comes down, it moves up and makes the space, more for the baby. So all this is happening. And we are trying to sideline all this by inducing women, or, just scheduling a C-section at 38, 39, 37 even weeks. We are not considering that maybe the lungs of the babies are not ready. The baby will go to NICU. Baby will need a lot of support and care, which is artificial, because we are not letting that process happen. Also, in last few weeks of pregnancy, the baby's brain, the neurological connections, they develop in highest amounts, because now the baby is getting ready for the transition from womb to the life on earth. So baby needs to learn lots of things. So that is also happening. So we are cutting this process by scheduling our deliveries and forcing people into inductions, etc. So in a physiological birth, labor starts naturally. It proceeds naturally. Generally, in home births, we give a lot of support to the woman, and she is also prepared that labor is going to be intense. I'm not going to lie to you. Labor is never easy. Labor, that is why it is called labor. It is pain. But I like to call it intensity rather than pain, because our perception of pain can be changed just by changing our mindset. We don't have to suffer through the pain. We can always ride that pain. We can always devise tools to find my comfort even in extreme discomfort. That is what we literally keep doing every day. When we are stressed, we try to find an escape, at least mentally, where we go to our happy place and try to forget all this. And that's what women, improvise step by step in labor. Some women who are extremely scared of labor pain, they will be, saying things like, I don't know if I can do this and that. And by the end, when they reach active labor, when they reach, almost 10 centimeters of dilation, they say, I don't know where this strength is coming from. And in those transition moments, when I try to, give them a massage or touch them or try to support them, they're like, no, I've got this. I've got this. Because the labor has prepared me now for this transition. And I'm bringing life on this planet. I am powerful. Women suddenly start feeling that power. I'm not kidding to you. This is not imaginary. This is what I have seen in my home birth experiences. Even in my own home birth, my baby came out in 3 pushes in the toilet. I had to scoop up my baby from the toilet. But that moment was so empowering because I was told that twins is a high risk pregnancy. You will have a scheduled C-section, and don't attach yourself too much to the idea of natural birth. And one baby might be breech, one babies might interlock, babies might do this and that, and there might be complications, and one baby might die. That's the way medical system talks to you. They never instill confidence in women. They instill fear because their business runs on fear. If women know that they don't need anybody to birth their babies, doctors will be driven out of business, and they don't like that. Seriously, I mean, I ask my clients to ask questions to doctors, like simple questions like, will you allow me? Allow is again a word. Who is the doctor to allow you how to birth? I mean, you are the owner of your body. You should decide how you want to bring out the baby. But yeah, so will you allow me to birth in an upright position? And most of the time, sometimes I get the answers from doctors like, yeah, we can do that, but I don't know how to do that delivery, because I am only told that women lie down on their back and we hold their legs up and they push. But logically and physiologically and naturally, that is the most unnatural position to push your baby out. Because when you're lying down, this coccyx doesn't have the space to move for the passage of the baby. So the baby has to travel upwards, because babies travel like this, against the gravity. Woman needs to push more, and then they have devised something called episiotomy, where they cut your vagina towards your anus so that baby comes easily, which is like very absurd for me because I have seen women give birth in squatting position, standing on all fours like cows, in one knee lunge like a runner stance, in so many different positions, on their sides, just lifting their one leg. Some women would like to lie down, but they find their own comfort in that position. So all this is so natural. That is how our grandmothers have been giving births, and that is what I see in undisturbed births people doing. But I don't know, like, lying on your back and is only for the comfort of the doctor who needs to see what is going on. And I don't know why they need to see what is going on. Because once you do that, you introduce the chances of a shoulder dystocia happening. That is, baby's shoulders getting stuck. So Aina May Gaskin, the famous midwife from USA, some of you might have read her books like Spiritual Midwifery. She devised something called a Gaskin manual. She said if women is having difficulty lying on her back, if a ball is stuck in a tin container, in a square tin container, would you devise tools to get that ball out, like forceps and vacuum? Or Could you just move the container to get that ball out? So, same logic. Can you just move the woman upright and let the gravity work and let the baby come out? Can we do that? Of course we can. Even WHO says every woman, every birthing woman has right to use her own position. But doctors, most of doctors in India, even in abroad, they're like, but we are trained in such manner. We have been practicing for last 20 years like this. How can we change the practice as if it is so sacred? And that is why I say again and again, modern obstetrics runs on superstitions rather than evidence-based scientific facts. I no regrets. I mean, you can call me names, you can say anything, but I do not take these words back. Modern obstetrics is superstition. Because you are not using what the evidence is showing you. I really think that obstetric students, the final year PG students, it should be compulsory for them to attend at least 1 to 3 home births to see how natural birth unfolds. The fact of the matter is, medical students never see an undisturbed birth. At most, in public hospitals, they are seeing medically managed vaginal delivery, which we call normal delivery. But there is a day and night difference between a normal delivery and a natural physiological birth. Same with the placenta. Once the baby, for people who don't know, baby is there in the uterus along with the cord which is attached to the placenta and the amniotic sac which has the amniotic fluid, and baby is floating in this amniotic fluid. And when the birth happens, baby is coming out, baby comes out, the placenta that is attached inside the wall of the uterus, it starts detaching and then it comes out, and then the birth is complete. So birth is never complete unless until the placenta comes out. The general management of placenta, because there is this huge fear in the medical system that every woman will bleed to death in the placenta birth. So what they do is something called third stage active management of placenta. That is, as soon as the baby comes out, they will give you a shot of artificial oxytocin to make your uterus contract. They will put their hand inside your uterus and scrap the uterus and try to take the placenta out. They don't like to wait for the placenta. But in a natural physiological birth, generally placenta takes at least 20 minutes to detach properly and up to 1 to 2 hours to come out. That's what I have seen in home births I have attended. And most of the midwives, if you read or listen to the natural birth side of the thing, they will say, yeah, placentas take time and we never separate the baby from the placenta until and unless the baby starts breathing. In normal medical model, and that's what happens in nature, nobody cuts the cord. Generally, women take their time to cutting the cord, but medical model immediately clamps and cuts the cord, which is the lifeline of the baby. And then if the baby is not breathing, they will start slapping the baby, rubbing it and giving the oxygen, lots of things, when all that baby needed was being on the chest of the mom, being stimulated a little bit, and leave the cord attached, for God's sake. Cord and placenta are the most important resuscitation equipments. Science shows this, but doctors believe more in their oxygen masks and ambu bags and their things that they put inside the baby to suction the baby. All this is most of the times is not needed in a physiological birth. If a physiological birth was dangerous, people would have never opted for home births, but they are opting. The fact that I'm getting clients and I get at least 2 to 3 calls a day about where are you? We want a midwife for a home birth, means that people are looking for options. I know home birth is not for everybody. Physiological birth might not be for everybody, but because it takes a lot of resilience, physical, mental, emotional. a woman is in highest state of health in pregnancy. So as opposed to what you are told that you are more susceptible to infections and this, so take these vaccines, Tdap and this and that. No, woman is in highest state of pregnancy because nature favors continuation of the species on the planet. So many women who had chronic conditions going on, they get fixed in their pregnancy. Many of us have experienced that. So uh, uh, so the body knows, you know, how to gestate the baby, how to birth the baby. So it doesn't really need all that testing and fears, etc. I know there are doctors here who will think to the contrary, but this has been my experience that women who don't even take one ultrasound, I've never seen unfavorable outcomes. And because of the fact that I'm not afraid of breech babies, that babies sometimes come butt down. You know, not all babies come head down. Most of the babies will come head down, but some will come back down. And doctors are very scared of breech birth. So if the baby is showing breech, the doctor will be like, yeah, you will have a C-section. So all this is going on in a physiological birth, you know, the undisturbed process. The baby knows how to navigate through the pelvis. Baby has this perfect blueprint. At the end of the pregnancy, the baby is sitting either on the left or the right of the mother in most of the cases. Sometimes babies are sitting posterior like this also, but they generally are like this, and they move, turn slowly, engage their head in the pelvis, and they know exactly how to engage their heads in the pelvis and how to rotate. You know, their head and the bodies are generally at 45-degree angle. They put their head, engage their head, and then the body gets inside the pelvis. And when the head comes on the perineum, there is outer external rotation is happening. That is, baby rotates and gets her shoulders be below this pubic bone and comes out. So all this wonderful blueprint is there. So nobody needs to cut you and pull that baby out, or nobody needs to use forceps and pull that baby out, or use a vacuum and pull that baby out. No, your body knows how to expand when it is given privacy and safety and reassurance and gravity. For God's sakes, let's not forget gravity. So all that is happening, and the baby knows how to come out. There are rare cases where there are pelvic deformities, women who have had, you know, some deficiencies and their bones have not, pelvic bones are deformed, or babies that have genetic abnormalities because of which their heads are of abnormal sizes, or there are lots of things where the baby cannot come through the pelvis. In those cases, in those rare cases, which we call cephalopelvic disproportion, CPD, in those cases, yes, cesarean is justified. But telling a woman that, oh, you are just 4 feet and you are just 5 feet, so you cannot give birth naturally, is totally absurd. You cannot know if a woman will give birth naturally or not unless and until you let her go in labor and try it. We always, you know, they don't even take 10 minutes to prepare the OT for a C-section. Once a woman says yes, once the family says, yeah, cesarean kar do, they're so quick to do a cesarean. So why can't they be quick when there is an actual emergency? They can be, obviously. But why to scare a woman even before her labor starts that she cannot give birth? Why to plant that doubt in her brain? And that has been the bone of, you know, main contention of midwives, that let it happen naturally. That's what we have been saying, because we are trained in natural. And not only modern midwives, even our dais, the wise women of the community who have helped women through the generations give birth in their communities, they've always seen this process unfold. They have learned lots of things with different births. They know what can be done in this situation naturally. How can it be helped naturally, rather than just taking out your scalpel and cutting the woman out. So there is going to be a fundamental difference between obstetric care and midwifery care, because midwives, what we call, are doctors of normal, and OBGYNs are trained surgeons. They are trained surgeons. And this is coming from a very dear friend, OBGYN of mine, who is old, but I call him my friend because he's just amazing. He has 40 years of practice and he is an expert surgeon. And he says, I graduated from my medical school doing 80 to 90 cesareans, and that was enough for me to get the MD in obstetrics because I'm a trained surgeon. But now the people who are passing out, they are witnessing at least 800 to 900 cesarean sections before they pass out as MDs in gynecology and obstetrics. So we can see where it is going. He says, lots of times I don't have a say why a woman is coming on the operational table. I'm there as an expert surgeon, so I'm there to overlook the surgery, that nothing goes wrong. But I don't have a say in which, like, if I don't get to ask, why are we doing this cesarean? Is it really needed? So I'm just called as an expert surgeon, so you just shut your mouth and do your work. That is what is going on. So there is money involved. Of course, a cesarean costs anywhere in big cities more than 50,000 at least. At least. In cities like Hyderabad, in 5-star hospitals, corporate hospitals, have seen up to 5 lakhs of bills shoved down the throat of parents for cesarean and this NICU stay. Because obviously, once you have a cesarean, when the baby was not ready, baby is going to need extra help and an ICU admission. And that is part of the equation, part of the business. So we can see why we are playing with the entire generation, with the health of the babies. And that is where this natural birth movement is gaining momentum. People are asking for options. People are tired of what they've been told, that birth is dangerous. Actually, birth is a normal physiological process, and where doctors say, oh, there are a million things that can go wrong in a birth, midwife will say, oh, there are a billion things which can just go right and that baby will come out. Maybe little later than expected, but it will. So I would just like to tell you, share 2-3 experiences. Recently, last week, I was at a birth where that woman had had three previous cesarean sections, and she was like, I will die, but I'm not going for a fourth one. So will you help me? And I said, okay, if you are ready, I'm ready. And she broke her water on a Monday. Her contractions started on a Wednesday, on and off, on and off. Then they gained momentum on Thursday, and she had intense 24-hour active, almost active labor. But she was getting a lot of rest in between intense contractions. And she had her baby on Saturday morning. So first of all, with three C-sections, the doctor would have said, no way, you're not going into labor. We are cutting you open at 37 weeks. We can't take the risk of letting you go into labor. Once the water breaks, doctors are like, no, in 24 hours, the baby has to come out because there is risk of infection. Actually, I will say there is risk of infection because you are putting your hands inside the woman to check her dilation hundreds of times. So you are introducing infection. If nothing goes up the vagina, most of the times women, our own bodies, our immunity, and maybe with little bit of vitamin C, baby will be fine, just doing fine. We can monitor that, and we have tools to monitor that in hospitals as well. But nobody wants to take this risk. So always this question about birth, that who takes the responsibility? We are going into the hospital signing 50 different types of forms saying that we are not responsible if anything happens. We will do our best, but you cannot hold us unaccountable for something that is out of our hands. And birth is a mystery. Nobody has control over that. Okay. So actually, who is responsible for the birth of the baby? If doctor is not responsible, if the hospital is not responsible, if the legal system is not saying they are accountable and responsible because they are protected so well legally, then who is responsible? And it boils down to I am, because this is my baby. And this is where I need to trust my body and give my body the optimal conditions to birth my baby out without fear, without interventions. And that is why people are asking for alternate choices, midwifery care, and it has to come to India. It's high time that we do this. And anyway, so I think I digressed a lot, but it boils down to what I like to teach and what I say. Again, I would like to tell a little nice story of how intimacy plays part in the birth. Because again, oxytocin, we need oxytocin. We need somebody to hug us, kiss us, tell us that everything is fine in birth. So I was at a birth. I was apprenticed by then, and my two midwives, they were wonderful people. We get a call from the client that, okay, I'm having contractions from 5 in the morning. So we ask her, usually we tell clients when they call us and when they are able to text, that just eat, sleep, take rest, ignore the contractions until you cannot ignore them. There is no rush. Your baby knows what to do. Your body knows how to open slowly. So that happened, and at 2 p.m. she says, okay, now I'm having contractions every 10 minutes and I want you guys to come. I need that support. So we go, we fill up the pool, because she says, she cannot take the pain, she would like to use some water. So we fill up the birth pool. She goes into the water. Then we see the contractions spacing out. Then my midwife just gently asks her, would you like to use gravity? Would you like to come out and walk maybe, so that we get the contractions going? And she's like, yes, but I'm afraid of the pain. I don't want to come out. So my midwife just looks her into the eye and she says, you have to take this thing on your horns. There is no escape from pain, but there is something beyond that pain. Your baby lies beyond that pain. Can you do that? And she says, yes, I can try that. And then she goes out of the pool, she walks. My midwives, they dance with her. I have a beautiful, beautiful video, and I cry every time when I watch that video, how a laboring woman has to be supported. She dances, she swirls her hips, she moves her body, her baby gets into a good position. And now my midwives are like, you haven't eaten, would you like an ice cream? And she said, yes. So generally people in labor, they don't like to eat, but they need energy. Generally the digestive system completely shuts down because all the blood flow is towards uterus now and your genitals, and it's opening, expanding, but you need energy. And in hospitals they give you IV lines, but that makes you engorged. Body doesn't know what to do with that extra fluid, and after birth it boils down to engorgement of your breasts, your body, a lot of edema. It's not very pleasant. Anyway, so we ask her to eat and she eats. And then my midwives are like, let's get the partner, go to the toilet. She goes to the toilet. My midwife tells her, you have to go beyond this pain. Tackle this, don't run away. And she says, yes, I will. She goes into the toilet, labors on the toilet for a while. And then my midwives send in her partner and ask him to just, kiss her lightly on her head and just be intimate. He goes inside, they spend some moments with each other, and she comes out pushing. She comes out, she sits on the birth stool, and she pushes her baby out while the partner is holding her from behind. And that birth has made such an impact on me, because when she was pushing the baby, I could feel the air vibrating, because the birth energy was so contagious. And there is so much oxytocin that it gets into the air and it affects the midwife. So we are also drunk on oxytocin. I'm not kidding. It happens. It happens every time I attend a birth, because there is so much love and acceptance and welcoming energy. And birth has a very different energy. It just rushes. You cannot escape that. And I just feel for the doctors who just kill their consciousness, shut that off, and close those receptors for that oxytocin and just do it mechanically. Cut the woman, get the baby out, pass on the baby to a neonate team. No, I mean, how much they have to kill their soul, I don't know. Literally, because I can I cannot. I see that energy coming when women are pushing their babies out, and then that baby comes out and we all of us are crying, and amazing. So that was one of the one of the birth stories. I've seen many more like that. And just last year I attended a birth of a woman who had had 4 C-sections before, and she gave birth to her 5th baby at home. And oh my god, I can't even describe how beautiful it was. And she still is in contact, and she now is becoming a doula and teaching other women about physiological birth. And so this positive birth is like a drop of oil on the water. It spreads. Positive birth stories spread. We always have listened to horror stories about birth, emergencies, this and that. But when a woman tells that I have given birth at home, my own grandmother, I have grown up listening to my grandmother who gave birth to 6 children at home. My mother who gave birth to me almost in the door of the public hospital, because she was walking towards the hospital in intense active labor. Crazy lady. But that's how, and that always gave me the confidence that if they can do it, I can do it. And I have more equipment available to me, more resources available to me, more nutrition, more supplement, more of the, what we can do prenatally, how I can prepare myself. Everything is available. Why that? That is the question I want to pose to our pregnant ladies here, that we are there to help you. Help is always available. We just have to ask for it. So when we look for options, we have options. If we don't know we have options, we don't have options. So yeah, that boils down to and the last part that the poster said, how do you have an intervention free birth in hospital? That is tricky. But there is something called a birth plan. So you educate yourself on how your body works in labor, how you can labor maximum time at home before going to the hospital. What are the interventions that are done in hospital? So read about, what is meconium? Why the doctor is saying there is cord around the neck, and what can we do? We have to do a C-section. Is there evidence to it? Because I have seen babies born with 2-3 rounds of cords around their necks, and there was no problem. And a dai I used to learn from told me a very beautiful story. She used to say, um, the babies who come with cord around their neck, they have this strong influence of Krishna and Vishnu on their lives, because Krishna likes Vaijayanti always in his neck. So it was so beautiful that they understand that birth is not only physical, it is psycho-spiritual emotional event. And when woman is supported holistically, most of the times she won't need all those interventions. So negotiate that birth plan with your doctor. Things like, I want to give birth in an upright position. I don't want you to cut me an episiotomy. I want to push my baby in however time it takes. I want to birth my placenta on my own. Don't separate my baby from me immediately after birth. Don't clamp and cut the cord. We call it a delayed cord clamping, because all this is there in WHO Charter of Rights of Birthing Women in Hospitals. Nobody reads it. Doctors don't pay attention to it. Doctors don't even consider that patients have a right to informed consent, that they can deny any procedure and any drug. If they are informed about it and they say no, doctor legally is bound to stop and not administer that thing. But people are putting lots of things in our IVs and we don't even know what it is. Women are drugged right and left all the time in labor. There are antibiotics, there are oxytocin, there is methargin put in their anus, so many things that are very invasive and very violent, and women even don't know what is happening to their bodies. No, that is not the way we should be going into the hospital totally uninformed. You know, educated urban women are most doomed because we don't ask questions. We think that they are following science and science is what we have to believe in, because the science is the new religion. Very fanatical. Nobody can say anything against science, and I really think obstetrics is not a science. But anyway, so we prepare for our exams, we prepare for our career, even we plan our weddings for months and months meticulously. We spend so much money in wedding shoot and pregnancy photo shoot and this and that. Why can't we take birth education? Why can't we hire a doula? Why can't we ask questions to our doctors? And why can't we make a birth plan? So you are the care provider, I am the consumer. You need to respect my wishes. This is how I want my baby to come into this world. You are there for emergencies and I understand that, but every birth is not an emergency, and probably my birth will not be, because I'm not a number, I'm a human being, I'm not a statistics. So if that consciousness comes, we can have positive hospital births. There are hospitals now, namely Fernandez Hospital in Hyderabad, who are bringing midwives. There are a couple of birth centers in Bangalore, in Kochi, in Hyderabad. Many people in our group have given birth at Birth Village in Kochi, which is midwifery led. So we can always ask for options. Anyway, so it's almost, we have just 20 minutes left. So I would like to answer some questions here. Is gestational diabetes a reason for scheduling C-section? Not at all. Not at all. First of all, gestational diabetes is not a very severe disease. It is just altered metabolism of placental influence, because placenta wants baby to have glucose 24 hours available in your blood. So placenta inhibits insulin. It creates insulin resistance. But in women who are pre-diabetic or who have very sedentary lifestyles, I would say as soon as they get the positive gestational diabetes test, actually even that is not scientific to make you drink that horrible sugary drink. Actually, you should be monitoring your blood sugar levels at home before and after meals, and your fasting levels, and see if it is fluctuating too much, and then then show it to a doctor and ask him, am I a gestational diabetic? So even if there is a gestational diabetes, first line of action is change in your diet. Get protein rich diet, avoid carbs, get the activity going. This bed rest thing and rest as much as in pregnancy is not true. Women have always worked in fields. They have gone for hunting, gathering, even if pregnant. They have ran from predators, our ancestors, even if pregnant. There was no excuse. So women have always been active. So be active in your pregnancy. And at 37, 38 weeks, if the gestational diabetes is going, out of hand, there is always insulin, and always the body's wisdom that if baby is not safe inside anymore, the body will start labor. You have to trust that. But no doctors trust that, and they ask you to schedule a C-section, even if you're not a severe uncontrolled gestational diabetic. So there is a very fine line. So I will always say take second, third opinion and wait for labor, change your diet, be active. And if there is really medically it is needed, maybe you can take insulin with your doctor's advice. Obviously, they will prescribe some kind of drug, either metformin or insulin, and wait for the labor. So yeah. What other? Somebody had asked, is VBAC possible? Yes, it is. Not only after one cesarean, after 2, 3, 4 cesareans. I've told the stories already. What else did you? We just had. Yeah. You had baby 15 days ago. Wife was 40 plus 5. The baby was 4 kg and the head was not fixed. Head not fixing is not a reason for C-section. Sometimes head fixes in labor. There are exercises you can do when 40 plus 5 is nothing. You could really wait up to 42 weeks and more. I have seen 4 kgs babies born normally, naturally, without any problem. So body, first of all, body will never make a baby that is very hard to birth, that cannot be birthed. In very rare situations that happens. 40 plus 5. Why I don't believe in this 40-week mark is, it is based on the assumption that every woman has a 28-day cycle and she ovulates on 15th or 14th day of her cycle and gets pregnant, and then the pregnancy has to continue for 40 weeks. So when you are calculating 40 weeks, you are not even pregnant for first 2 weeks of it because you haven't even ovulated. And every woman does not have a 28-day cycle. That is absurd. So and again, there was one study that said there is increased risk of stillbirth after 40 weeks, but it is actually 0.5%. And that is the risk even at 38 weeks. So no baby is, immune to something called death. There is a very fine line. Birth is a fine line between life and death, of course. And not all babies are destined to survive on the planet. They have a destined walk and then they will move. I'm not saying we should not save babies and we should leave everything to nature, but to save one baby out of 2,000 babies, telling every woman that her baby has to come before 40 weeks because there is 0.5% increased risk of stillbirth is not fair. And women can easily go to 42 weeks, even 43 weeks. And heads do engage. Head not fixed is definitely not a reason for a C-section. It was just that your doctor was not patient enough and did not know. What if I'm sorry for what you have faced, but you could have waited. There are exercises that could have been done. What if labor pain is stopped at 9 centimeter dilation? Labor pain stops at 9 and 10 centimeter dilation, mind you. Uterus has contracted for long to dilate, and now it needs rest. It should be left to rest without any fear. I have seen a woman who was dilated 10 centimeters and she slept because she was tired for 8 hours. She woke up pushed out her baby. So when dilation is complete, there comes a phase called transition, where baby is now transiting through the pelvis. It has, the head has reached these ischial spines and now it is coming, the baby is entering the birth canal. It is called transition and body takes rest. Labor does stop at 9 and 10 centimeters. There is just the matter of letting the woman sleep. And you might have heard, oh, she was sleeping. Doctors are like, no, you can't sleep. You have to push the baby out. Otherwise, baby will suffocate. No, that is not true. Babies need time because babies are under continuous pressure with contractions. Now, when the baby's transition, it needs time to adjust itself before coming out. Also, our cervix has dilated, but our vaginal canal also dilates to let that baby out. So babies need time, labor can stop, and that is perfectly okay. The woman just needs rest. And if you are very scared, you might just monitor the heartbeat of the baby. If it is showing just normal decelerations, that heartbeat does go down during contractions, mind you. And baby's heartbeat varies between 110 and 165 normally all the time. That is called variability, and that is indicator of the health of the baby. And most of the times listening to heartbeat is not a very accurate measure of uh, understanding baby's well-being. There is a lot to it, but I won't go into details. It will be a lecture on anatomy and FHTs. I don't want to do that here, but yes, women can rest and babies will take time and come out on their own. If we wait one more week, they said baby will grow bigger. No, not true. Not evidence based. Evidence does not show that. Babies babies never grow beyond the point where they cannot come out. That is a possibility only when you have uncontrolled diabetes. That is when baby is puffing up with all the sugar that is available. But in normal healthy pregnant women, you can of course wait to 40 weeks, 42 weeks, 43 weeks even. Just wait for the natural delivery. If you are very scared, get the biophysical profile done, get the NST done, get the CTG done every 5 days, because one NST and biophysical profile holds good for 4 days. And you don't even have to do that. Just tune into your intuition. Is your baby kicking? Are you feeling your baby? Are you feeling well inside? That is the indicator. That will always tell you, okay, everything is fine. I think we can wait. So, every case is different, but in general, yes, we can wait, we can monitor the baby and we can wait. All right. What if baby passes meconium and labor not started? Generally, that is not a cause of concern. Baby is passing meconium from 20 weeks. What is meconium? Meconium is the thing. Baby is swallowing amniotic fluid all the time. The amniotic fluid is there in baby's lungs, in the baby's gut, and it is passing urine, which again comes as amniotic fluid. It passes bowel movements when they are practicing the bowel movement. Meconium is the residue of the amniotic fluid, which has fat cells, baby's hair, dead skin, etc., etc. And babies do pass that. Sometimes babies are in a weird position in uterus and they are having something called an oxygen insult, where the cord is twisted and baby just can't find, and for 1 or 2 moments the oxygen supply is gone. So baby passes meconium. Just like when we are scared we need to go to the bathroom, something like that. But babies generally adjust their position in the womb and then they just do the cord, straighten out the cord and it goes away. So meconium in every case is not dangerous, first of all. Secondly, if there is thick meconium, that is an indication of something is going on rather than a problem. So if baby has some underlying genetic defects or an organ that has not developed properly, or something that is causing oxygen deprivation to the baby will pass meconium. So baby passing meconium is an indication of an underlying thing. It is not a cause of distress. Okay. When this happens, the baby has, first of all, unless and until you break the waters artificially, you will never know there is meconium or not, because it is not caught on ultrasound most of the times. If the water breaks before labor starts and there is staining of the water, the babies should be monitored, heartbeat should be monitored. The mother has to tune in and see what she's feeling. Also, we can encourage some exercises to encourage labor. in some rare
You'll
cases,
be angry at you.
I don't think so.
no. Can you mute yourself? Yeah, please. Yeah. So what I was saying is babies can be monitored, and not every meconium, not every baby is going to swallow that, aspirate that meconium, and it's going to going into lungs, and then baby will have distress. That happens to one baby out of what was the statistics? 800 babies. So all meconium is not a cause of C-section and not a cause of cause of any intervention. If you want, you can DM me and I will give you more resources to read on meconium. Meconium is given as the leading cause of C-section, but it is not evidence-based, really. So if you want to read more about evidence-based birth, you just go to www.evidencebasedbirth.com and read the evidence on meconium, what midwives have been seeing. I have seen babies born covered in meconium. I have seen people leaking meconium stained fluid in labor, and still babies have come out most of the times. Sometimes if the emergency has to happen, it will happen at home or hospital. There is no guarantee in birth. Birth comes with risks. I think hospital birth comes with more risks because people do lots of things that are not needed and intervene in the process, in the natural process. Home birth can have risks, and that is why we are thankful that there are hospitals and we can transport the mother and save the babies, mostly. And sometimes babies are just not destined to survive. Our older generations accepted death as part of birth, as part of life. We are not ready to, because we are having 1 or 2 children and every child is precious. But at the same time, we are subjecting them to so much medicalization of birth, so much vaccination, so much everything, that I don't know who values life more, them or us. That is the question we need to ask ourselves. Please answer this as well. Okay. What is +5 in 45? Can someone ask? +5 is +5 days, 40 weeks, 5 days. Do we monitor baby's heartbeat during home birth? Yes, we do. I do. If the mother thinks that there is something not very right, she might ask me, can you listen to the baby? I haven't felt the baby for a while. I'm feeling something is off. In that case, yes. But generally, we rely on, are you feeling the baby? Are you feeling the baby move? Home birth, that is what I'm saying. Home birth involves a lot of preparation prenatally. You need to connect with your baby, have that communication with your baby, and tap into your intuition, because you are the best person who can say what is happening with the baby. No doctor, no machine ever invented can give you 100% guarantee of how baby is doing. You know inside. That is my answer. I was patient, doctor was okay, but our family was the problem. Yes, family is problem most of the times. That is why we, in birth classes, I make it sure that a mother-in-law, a mother, a father, and a husband, whoever is going to be there in with the mom, they are educated. They need to be told that labor takes time. They need to be, they need to learn the techniques of supporting a woman labor longer at home. Don't rush to the hospital if the water is broken. Don't rush to the hospital in early labor, because when you go to the hospital, they are going to augment that labor. They want to speed up the process because they cannot stay there whole night with you. They have the system. They want you to fit in that system. They don't want to follow your labor. And midwives, we follow the labor. We sit at the feet of the women, of the laboring women, and take their lead and not force our leads onto them, not force our uh, priorities and my life and my kids and this and that, and I have to attend a conference. I need to go. I need to catch a flight tomorrow. So you need to deliver your baby in 2 hours. Otherwise, we are doing a C-section. No, that is not the way women should be treated in labor. Thanks, Tapasya. Okay. All right. We are 4 minutes away, and I think I covered most of the topics. I don't want to prolong it too long. But I hope you learned something. At least I would say learn to ask questions. Learn to ask questions to your doctors, and that is my only wish, and I only pray to all our listeners. Yeah.
Thank you, Tapasya.
Okay.
Thank you.
Thank you.
Okay, thank you. Thank you for all the nice comments. That makes my ego feel good. Yeah, thank you so much for being patient, listeners. I know I talk a lot. So yeah, I enjoyed the session as well.
Yeah,
And I'm looking forward to spreading the link when it comes on YouTube.
sure. Thank you for this wonderful session, Tapasya. Thank you.
All right. Thank you so much. Have a wonderful night. Bye-bye. So shall we just stop the recording?
Yeah. You can just end it and it'll stop by on its own, and then it'll convert it for a while. Just let it happen, and that should be fine. Yeah.
All right. So I just leave the meeting now?
Yeah.